Hello and welcome to Check 1 2, where we talk to survivors, advocates and supporters of testicular cancer awareness here at the world famous podcast studio Glasgow. Today's episode is with David King. David was diagnosed with testicular cancer only in October last year, and so is very much in the throes of it. David's journey, he claims that it's not exciting or much worthwhile telling, but believe me that it is. We talk about the anxiety of things that maybe didn't happen or could happen. We talk about the fact that there isn't enough information out there for guys in terms of what they're going to go through and how Cahonas is trying to combat that. But also David's story really articulates it well, and how he navigated, being told that it was a cancer, not just with himself but his friends and family, and how that felt going forward, and the things that he wants to bring awareness to. It's a really inspiring story. Much like all the rest of the guys who've been on, David really has a passion for advocacy now and about getting that awareness out there. So ladies and gentlemen, David King. We'll just get going then, buddy. You just tell us a bit about yourself, a bit about your cancer journey, and then we can just talk through it all. And
of course. Well, just as we were saying there, first I'd like to thank yourself and Richie for having me on. It means a lot to me. One, I want to be able to talk it over. I've not really spoken to anybody outside immediate family, not discussed much with friends apart from telling them what had happened and things. But and I'm looking to raise awareness for people that maybe want to, or they might not know what's coming, and some things aren't as bad as what you think, type of thing. So I just wanted to, that's the reason that I was wanting to come on. So I appreciate you having me on.
Oh, always, mate, always. Honestly, we appreciate you take the time out of your day to kind of come and talk to us about this.
So first of all, name's David. I'm 43. I'm married to an amazing woman who helped me no end through everything. I've got a fantastic wee boy, and basically I have a great life, and I was thoroughly enjoying myself. I probably the fittest I've ever been. I was booked to go on holiday in October, and as you do a few months before, losing weight before you go on holiday and stuff, so you can enjoy the holiday more. And I was going to the gym lots and doing lots of fitness classes, but probably one of the kind of main classes I really liked was a spin class. So I was going to that, and I don't know if it's my instructor or what happens, but there's up and down and sitting on the seat and all that kind of thing, and I thought maybe I'd bashed myself. But there was no lumps or no pain or nothing drastic like that. I think the only way I could describe was I kind of changed shape, and I'd kind of gone from a round testicle to more like a rugby ball kind of shape. And if you could imagine the rugby ball where the seam would be, I became much more noticeable of my testicle.
Right.
So it wasn't like sore or anything, but when you getting changed to that, it was there, whereas before I hadn't ever noticed anything. So it must have grown enough that I'd noticed it, but with no pain or anything like that. And the kind of ridge of the rugby ball kind of went a wee bit numb, but that was really it. And at the same time, probably just a coincidence, I had a rash, probably sweat rash from doing all the classes, and I was buying jock itch and different cream put on it. I thought that's maybe irritated things, and that maybe it's swollen up because of that. But it wasn't, when I say swollen up, not massive, it wasn't a great deal to me, didn't see anything. But for some reason I woke up one morning and thought, I'm going to see about that. And I don't know why. I wasn't that, I'd spoken about it the day before, or maybe say to my wife, I think my testicles a bit bigger or whatever, but wasn't worried anything. But for some reason one morning I woke up and thought, right, I'm going to phone the doctor and see about that. So that's what I did. Phoned the doctor, and I don't know if it's my local GP or every GP, you are 12th in the queue and all that kind of thing, to then you have to do a thing called Ask My GP.
Yep.
So you fill in the form online. So did all that, and then I thought, right, I'll wait. But because it just probably me as well, because I'd made my mind up, I want something done now. I thought, I'm not waiting. And I'd remembered maybe the year previous that I'd been to a men's health check through Bupa,
right.
Where it was like testicular and prostate cancer. So I'd been to check, and it was like a private doctors in Glasgow City Centre in St Vincent Street. So I thought, right, I'll phone up Bupa. And I mean, the doctor might take a couple of days, and right now I've decided I want it done now. So I phoned up Bupa, and the first person I spoke to wasn't very helpful. It took me ages to get through, and they said, right, you can see a doctor, but it'll be £70 for 15 minutes. And I thought, well, I'm not paying that. It's not that bad. I'm not that worried. I'll wait for the GP. So off the phone again. I thought, am I just being tight? Should I see something about it? Phone back again. And this time I spoke to someone else, and they said, oh yeah, we can get you an appointment tomorrow. It'll cost £20. I thought, right, okay, just do it. And then typically, once I'd booked, I was within the 24-hour cancellation period, so I'd paid the £20 and I was going to lose it. And then asked my GP, came back, come down tomorrow, see us. I thought, I've paid to go, I'll go up to Glasgow, I'll get a coffee, I'll have a wander about, I'll go and see about it. So went in to the Bupa place. As I said, I'd been there the year before, so I kind of knew where I was going, and I was quite comfortable going. They were really nice the year before as well, so quite happy with that. So eventually called into the room. It was a female. Probably, as a lot of other people, I was at that stage quite embarrassed, but by the end, anybody can look at me type of thing. I was just like, whatever, I'm used to it now type of thing. So that GP checked me out, said, yeah, absolutely, nothing out of the ordinary. Yeah, you're fine, but you would know a change more than anybody else. So we'll maybe you can make an appointment to go to the urologist and check it out. But to me, nothing out of the ordinary. Now, I don't know if she was saying that just to keep me calm and book an appointment for it, or I didn't think there was anything out of the ordinary. My wife didn't think there was anything out of the ordinary, so it probably had a point. But years ago, in like 1999, my grandfather died of prostate cancer, and he went to the doctor, and the doctor said the same, nothing out of the ordinary. But you go to a specialist, but he was like, nah, the doctor says I'm fine. But then it's too late, type of thing. So I thought, all right, okay, follow it up, that's fine. So I was going on holiday and to Dubai. My brother lives there, and I was going to visit him. And I told him, I've got the doctor, I've got something wrong. They said I have to go to a urologist, but there's nothing to worry about. So he spent a fortnight winding me up, and you're going to have one ball, and all these type of things, jokes and stuff. And I wasn't that worried at all. I thought it would either be a vein or a cyst or worst case benign type of thing. I didn't ever think, it never crossed my mind, I've got cancer or anything like that. And great timing when I phoned the urologist to make the appointment. It was like the second day I'd get back my holiday, so just fitted in perfect. So I went up privately to the Nuffield to see the doctor, and so waiting there. Called me through, went through, lie in the bed, and literally lie in the bed, one look and went, his exact words were, that's going to end up in the bucket. So I was like, right, okay.
Thanks, pal.
I thought he would check it more, or wouldn't say anything until done more tests or anything. So he said, right, quickly sort yourself out. And then he said, come with me, and we're going to go down to the sonography place for the ultrasound, and so he's then talking to the receptionist, and he's saying, and I want an emergency appointment as soon as possible for David. And I was thinking, right, what's going on here? Right, it's okay. So she said, right, that's fine. Gave me an appointment. It was a couple of days further down the line. So that was fine. I was a bit panicking, saying to my wife, he says it's to come out, and I didn't, but still hadn't really thought about cancer. I just thought maybe I bashed it that bad that it was to come out. I didn't really think too much of it. But then in the Nuffield as well, blood tests. So back in a couple of days, down to the sonographer, and I didn't see that doctor or the surgeon, who was like the expert type of thing, urologist. Again, but I went down to get the scan, and I was pretty nervous at that point. Stripped again, down, using the probe and stuff, and the sonographer said to me, "Do you want to have a look?" So I was like, "Yeah." So he turned the screen around, had a look. Said, "Right, so that's that one, that's that one," and you could see there was a big difference.
Yeah,
they looked completely different. So by this point, I'm thinking, and he was saying, "Well, you can see that there's blood vessels and a mass and all these type of words," but he couldn't. He's not allowed to say to me or anything like that.
Yeah.
So I was like, right, okay. And they never told me anything about blood tests or anything at that point. So left in Nuffield, literally out the gate, walking to the car that was parked in the street, and the urologist phoned me. So he'd already had them, and he said, "Yep, it's what we expect. It's a type of testicular cancer." He said, "I know you've come privately, but," he said, "the NHS are actually much, much better at this. Could you go to the Glasgow Royal tomorrow for 7 a.m, and I'll pass you over to my pal and I'll tell him to get this done quickly." I said, "Right, okay." I said, "Why is it?" At this point, I'm panicking, and I said, "Like, why is it to be so quick? Like, does this need done urgently?" Like, and he said, "Look, it'll need to come out. It's a type of cancer. We're better getting it done sooner rather than later, but it's not going to kill you." He said to me, like, right in the phone, "You're not going to die of this. We'll get it sorted, but we need to get it sorted." So at that point, upset in the car. Gemma's, my wife's with me. I'm in tears, and then phone my mum in the car. "Yeah, it's not good." He says it's a type of cancer. I have to go to the Glasgow Royal tomorrow. So no sleep that night, obviously. And then up to the Glasgow Royal and up to Ward 70. The urology ward, and you kind of just the beds with the curtains around them, kind of standard ward. I was kind of taken aback a wee bit that I felt I was by far the youngest there. It was all older men. They were all getting like catheters fitted and stuff like that, and they were like in a lot of pain, and it kind of upset me a wee bit because I thought, is that what's going to happen to me? So I had more blood tests. Kind of lots of blood tests, and then they said, "Right, to go down, you have to go down for a CT scan." So they took me down. The porter came up with a wheelchair. He's like, "That's all right, I'll walk." Until 2 days ago, there was nothing wrong with me. I'm all right to walk down. I don't need wheeled in the wheelchair. So he took me down, and they put the kind of cannula in and the iodine solution through, and did that scan. Back up to the ward again. It was kind of a long day, but then I hadn't ever thought about it, but then one of the doctors came through and said, "Good news, cancer hasn't spread." That hadn't even crossed my mind. I just thought, well, it's to come out and that'll be it. I hadn't even thought it could spread to lymph nodes, or they told me it could go to my lungs. These things shocked me. I didn't even think, but obviously delighted that it hadn't spread. So then they said to me at that point, "Right, you can go home, but come back tomorrow for surgery. You'll go on an emergency list." So I took that again as, because it's an emergency. I need something so bad it needs to become urgent, and it's an emergency. But it turns out it's just, if somebody had been in a car crash and needed something sooner, then they would jump above me in the list of the surgery. But I'd never had an operation or anything like that before either, so that was all pretty scary for me. So back up the next day, again, no sleep. This time I had to fast, and I was put in the ward, in the bed, gown, socks on, that type of thing. And one of the kind of junior doctors came to take more blood and like missed my vein and like stabbed me in the arms. I was like, oh, that was really sore. So it got until about 3 o'clock and I still hadn't been taken. So I thought I'm going to get sent home again back. But then they said, right, well, we're here to take you. And they'd drawn like an arrow on my left arm to point to obviously to my left testicle. So when the porters came with the bed, the guy said, "Oh, you getting an operation on your arm?" I was like, "No, mate, I'm not. I'm getting a testicle removed." And he was like, "Oh, I'm really sorry about that," type of thing. So yeah, taken down to theatre. Hadn't been in before, and you're kind of in that waiting room bit before you would go through. And I was saying to the nurses, I'm terrified. And they were like so nice. I can't tell you how nice they were. Like one of the nurses, I wish I knew who it was, like held my hand and all that. Like, you'll be fine, you're going to be absolutely fine. And then I was in the kind of first room before you would go into theatre, and the anaesthetist was there. And I was telling him, I'm scared. And I said, "Oh, the doctor up the stairs missed taking my blood and stabbed me in the arm." And the anaesthetist, like, obviously does this 100 times every day. He's like, "I'll try my best," and all that. And then it's like, no, nothing. He didn't even feel it. And then he said, "Right, we're going to put a solution in just now." I can't remember what it was, but he said, "You'll start to trust us a bit more." And I said, "Right, okay." So when they gave me that, I could feel myself already falling asleep and stuff. And then said to me, "Right, are you ready?" type of thing. And the next thing, you're waking up. But I thought, will I feel my throat with the tube in your throat and all, these type of things.
Aye.
None of that happened. So I kind of what I'll probably talk about a lot today is the anxiety of things that never actually happened.
Yeah.
Was probably the worst bit for me. The not sleeping, worried sick, can't eat because of the worry of it all, and then these things didn't actually happen. So back up to the ward, my wife there waiting on me, type of thing, and luckily the surgeon had said if David feels fine, he can go home that night. So it was at 9 o'clock at night. So leaving the Royal, like all the doors were locked and stuff, but I was just delighted to kind of get home.
Get in your own bed.
Yeah. So I'd asked the surgeon, how they come and speak to you before they do it and stuff. So what happens next? And they said, well, you'll be back to see me in 6 weeks to check in the operation, but you might hear from the Beatson. So I took that, you'll hear from the Beatson if you need something further or something's not. I didn't realise. I thought that was it. I just thought I'll get an operation and I'll be, fine. I didn't even think about monitoring or the 5 years or anything like that. So, just went home, recovering. Everything was going fine. Down to the nurse. It was a much bigger scar than what I was expecting. I don't know why. I thought it would be through my scrotum. I didn't know it would be along the kind of my waistband. It's quite a big scar. Still there, obviously, just now. But yeah, so I was at the doctor's every couple of days to see the nurse check out. And I did that for 2 weeks, and the nurse said, right, yeah, everything's healed up, that's fine. Don't need to come back to see me or anything. So brilliant. So that night, lying in my bed, felt myself needing for the toilet through the night, went to the toilet, came back, lay down on the bed soaking. I thought, surely I've not peed myself or something. Is this a thing that could happen? Like,
Yeah.
And it turned out that I got an infection. You've just been discharged for the nurse to get an infection. So there was like quite a lot of blood stuff, and I would get a real fright that time.
Yeah.
But then back another couple of weeks at the nurses, antibiotics. So I kind of felt I'd been put back a wee bit. I kind of thought, I'm nearly up and running type of thing. So then she put, it was like a silver stuff to draw out infection and things like that.
Poultice.
Yeah, so it was all fine, recovering well. That was over my birthday, unfortunately. So, but I was hobbling about, doing fine, and then sitting on the couch watching the telly, and then get a phone call from I could tell it was like the hospital number, and I was like, what's that? I answer the phone, hi, it's such and such from the Beatson. I thought, oh my God, something must be wrong. I wasn't expecting to ever hear from the Beatson. I just wasn't expecting it. So then they gave me an appointment for like the following week or something. So I was like proper worried sick.
Yeah.
I'd phoned the surgeon to speak to the surgeon to say, why would this be? He said, oh, like, you're always going to the Beatson, you know. And then I eventually got a letter from that group, what's it called, where they all get together and discuss.
The MDT.
Yeah, the MDT. So I had that, and they said that, and what I was saying about wanting to, let people know, I had to chat GPT, like what's going to happen next type of thing. So they had told me if the tumour was over 4.5 centimetres, you'll get, there'll be follow-up and chemo and stuff like that. But I didn't know, nobody had ever told me anything like that till ChatGPT. So went into the Beatson again, terrified. But I think a lot of these things are in my head: tumour, Beatson, cancer, chemo. All these words were like really terrifying for me. So I went in, and it was to one of the oncologists, and she was telling me, yeah, it's over this size. So I knew there was going to be some sort of follow-up. So she explained to me that they'd estimate around a 30% chance of return. And I said, well, where's it going to return? Because it's not there anymore, type of thing. And she explained to me that it would be like lymph nodes or down into my lungs type of thing. Mm. She said, but we would highly recommend you had a carboplatin chemotherapy, a kind of 1 dose type of thing, where it would lower your chances of return to 5%. So I kind of took that as a no-brainer to get it done. She did say you don't have to. Some people choose surveillance, but at your age, you're a healthy young guy, just get it done type of thing. So that was fine. And in between going there and going to the chemo, you had to go for the kidney function test, which I'd never heard of before. So away up into the Gartnavel Hospital, getting the radioactive put in one arm, and then checking it spread round with your other arm, and then your heart, and then drawing the blood I think it was every hour, or every hour 20 minutes or something, to check how good your kidneys function, I suppose. But the second draw blood, I passed out.
All right.
Which I think you were supposed to, not fast, but there was no protein, no caffeine.
Right.
And I took it as, I better not have anything just in case type of thing. So, that kind of panicked me a wee bit. I'd passed out. I felt a bit embarrassed waiting up, all the feet in the air and the nurses and all that around me type of thing. But got through that. That was fine, no problem. The oncologist had explained she works out your dose of chemo, how quickly it's coming out, all that kind of thing by the kidney function test. So I knew what it was for and stuff like that. Mm-hmm. Then I think it was just a couple of days later, back up to the Beatson for the chemo. So you're kind of waiting in the waiting room, not knowing what it was, and then taken through into a wee room. I think there was about 6 chairs in it. It was kind of like dentist style chairs, and swing about type of thing. And they put in the cannula this time in my hand. I don't know why the hand instead of your arm is what I'd had previously. It must be something drips out or something like that. And then this kind of steroid solution. I flush the line first to check it's clear. Steroid solution to help your vein, and then get the chemo. But it's quite scary getting the chemo because you're getting it put into you, and the nurses are all going about with like all the PPE stuff on, and all the rubber suits and rubber gloves and all that kind of thing.
It's like they're dealing with uranium, You're
I know,
what's going on?
I know. It's like that's going into me, and then it's like the kind of brown bag comes up and they put it on. But it wasn't that bad. My arm went stone cold, but apparently that can happen. And you know, I saw some other people getting like a heater type thing on their arm, but you know, it wasn't too bad. Felt okay getting it and stuff, apart from this fear. Tea lady came round, you know, get a cup of tea and a biscuit and stuff, and you kind of feel a bit better. And then that was coming up for Christmas. So over Christmas, the oncologist had said to me, don't stay in, cancel Christmas then, but don't be hugging everybody type of thing. Yeah,
because your immune system would be totally shot.
So I was like, had the chemo, and I felt, the best way to describe it was a really bad hangover for a kind of few days. And, you know, the type that you're like, I'm never drinking again type of hangover. And then, but I had anti-sickness pills and steroids to take, and had them, and then started recovering, kind of getting all back to normal, back to the Beatson every 3-4 months for 5 years. But after listening to a lot of the other podcasts, you know, people are like talking it was 8 years ago and stuff. You know, I'm only just in it. It was only just October last year, so it's, you know, within the last 6 months. So I've got another Beatson appointment on a week tomorrow. So have that, and really that's it. Take it day by day or week by week, and I'm getting better. Just kind of feel quite lucky that I didn't lose my hair. These were the kind of anxieties that I had, that I'm going to lose my hair and I'm going to blow up, or I'm going to be really ill after it. And you know, they were fine type of thing. So yeah, that was really what happened to me. Yeah.
It's funny though, like at the start you're saying like I've listened to other podcasts and mine isn't that dramatic, but I'm sitting listening to you and it's like, but there was lots happened to you. You know, it's like even the like your own mental gymnastics with it is a lot. Do you know what I mean? So like,
I did certainly find that.
It's I think that's the thing. It's like, I suppose especially as like Scottish men, we do tend to downplay this stuff, but I think like your story is because it is different because of the way that you feel about it. But I never really thought about the anxiety of things that never happened. And because we all done that, I remember I was the same. Like I thought when I was going to get mine, I was like, so how did they do this? And I thought the same, they'd go in through the scrotum and they'd take it out that way, or they'd just snip and done a kind of,
that's what I thought.
Like they do a dug.
Exactly,
And I was, but I made the mistake of the night before looking it up on Google.
Right, okay.
And then I saw what the procedure was, and I was in a full-blown panic. I was curled up in the bed going,
what's happening here?
This is and it was like they're pulling it up through, and I'm going, this is happening to me tomorrow. It's wild.
No, I know. I mean, I would say that it was the mental side of that. I mean, I never once, I didn't think I was going to die, but I thought, chemo and all, I'm going to be really ill for a while. Like I'm going to lose my hair, I'm going to be really ill, I'm going to be, you know, blow up, sick, you know, and that was my main worries of how I'm going to feel. But then when it happened, it wasn't great, but it's like, it wasn't nearly as bad as I'd built up in my head of what was happening. Don't get me wrong, you see a lot of people in the Beatson that are in a lot worse off and getting chemo regularly, you know, and you know, it must be horrific for them. But for me, just that one dose, it was like manageable. It's now to the extent where if anything happened again, I'd be like, no, just touch wood, you don't hope it certainly doesn't ever happen again. But I'd be like, right, okay, what do we do to fix it? Rather than thinking, oh my God, you know, I know that I can get through it, if you know what I mean. I know how difficult it is, but I know I can get through it. So I kind of feel that way about it.
That's I think I'm the same. Like I would feel like that as well. It's like I touch wood, you didn't want it to happen, but you'd have more of an idea of what it was going to go through for
And
you.
see, that was the first time I'd been to visit somebody in the Beatson in a ward, but I'd never been, outpatient or anything like that. But see, even because I've been and I know what it looks like,
Yeah.
it makes it easier going back, if you know what I mean, rather than this first time of walking through the door and thinking, right, how bad is this going to be? But now I know what it entails, type of thing.
And I think as well, it's like when you're from like central, like the kind of central belt and kind of west coast and stuff like that, you do feel like when you hear the word Beatson, it's got as much as an impact, I think, mentally as the word cancer, because you don't really, you hear about it and I think you're right. It's like you don't really think about cancer as somebody being young. It's older. It's you think about the TV shows that you see, and it's folk like they're all losing their hair, they blow up, they get really ill.
That was it.
And it's always in your head.
It's like, I'm going to end up in the Beatson, almost like as if that's where you go. But when you get there, it's like folk just. I remember like waiting in for one of the appointments with the oncologist, and there's like, I'm nervous wreck, can hardly walk, and there's folk like, you could tell, like looking at their watch, like knowing they're going to their work, after it, type of thing. Like they're living through it. But at that time, I was like, how are they doing that? This is like such a huge deal for me, even being in there. But there was folk going like, oh, I've got my work, or I wonder how long this will be, or I need to go somewhere, type of thing. Yeah. But it was good. So like the last time I went, and then this time coming next week, my wife and I, we make a day of it.
Right.
You go get a blood test and stuff, and then go out for our lunch or something. Try and not take over your whole day. Thinking, oh, I need to go to this place, type of thing. Yeah,
I think it's a healthy thing to do. It just kind of helps you get over a bit.
I mean, I probably should have said earlier on, but I was thinking another reason I didn't think I had testicular cancer is because I thought I was out the age, because I was 42 then, so I thought it's guys in their 20s, young. I didn't think that, I didn't think you could, I never even thought you could get testicular cancer in your 40s, I didn't think it was a thing, type of thing. And they offered me, sperm banking and, a artificial testicle and stuff like that, which I'd imagine a lot of folk younger than me would go for, but for me that wasn't a thing I needed or wanted at the time, type of thing.
Especially if you're you're married, you've got you know what I mean. It's like you would.
Like my wife and I, my wee boy's 12, so it's quite a big gap before to have another child. But we weren't ever planning on having another child anyway. So I didn't need to, think about that type of thing.
The sperm banking wasn't something that you thought,
no,
let's do this.
No, I never really thought of that. The first blood test after my testosterone had dropped very low, and they were going to put me on like a testosterone replacement treatment. So that was fine. But then the most recent blood test I did, my testosterone had gone back up to a normal level, type of thing. So I don't need that either. So I know that's available for some people, but I don't know. I don't know if I'm infertile now or not, or I don't know if these things how they kind of work. But it wasn't something that I felt I had to do.
I suppose it's going to be different for everybody. It's I know that my fertility was like shot for about 2 years.
Oh, was it? Right.
Yeah, but I remember when we were going into the Beatson to speak to the nurse, like on my visits after. Yeah. It was Nicola at the time, and she said that weirdly, like we heard it but didn't hear it. Do you know what I mean? So she said, and my wife will always remember that. She, like Nicola had said, it was like 2 years. Like this could kind of affect your fertility for, and it was almost 2 years to the day that of that conversation that my wife fell pregnant. Oh, right, like with our wee girl. But during that time, you're you feel a bit aggrieved that you've you maybe lost your fertility and things like that, you know. And but it depends again the type of chemo that you get, and you know, because mine was a BEP chemo, so I lost my hair.
Right.
So I'd
was that like more than like one type?
Aye, so that was 2 doses over like 6 days in total.
Right.
So I was in the Friday to the Monday, and got chemo every night.
Right. Okay.
And that was done, you know, I think it was over 2 months, but I ended up with avian flu and all that. So my chemo my second one got put off because I was in for Father Royal with bird flu.
Right. Okay.
So
yeah.
but I've said this a million times, like the only time that I kind of had cancer when I was younger growing up was a young guy that I grew up with, Christopher. He had leukemia and died of that. So I remember like being like hearing the word cancer and going, God, like all these thoughts, like you're saying, like the stuff that doesn't actually happen though.
I mean, it's like what we've spoken about previously is like the people that will say, I mean, you're lucky because you got a cancer that's treatable and stuff.
Aye.
I think, well, only 180 or 200 people diagnosed with testicular cancer. Like, I'm not that lucky. Like, let's be honest. I've had to lose a testicle here, and it's not, that overly lucky.
It's like I'm not going to run out and put on a lottery ticket now.
I know.
We were having a conversation the other day. The Lord Lieutenant of Dumbartonshire came in for a meeting with us.
All right, great.
She was awesome, right? But when we told her the stats, like, so she was one of the kind of like head honchos that kind of helped create the COVID hospital and all that. She basically was like, had retired and they phoned her back because they kind of needed her expertise as such to kind of create this space. So we're telling her the stats, and she put it in a way that me and Richie had never thought about it. So say it's 2,400 a year UK wide for testicular cancer, and average over the last 10 years, it's been around 200 guys a year in Scotland. And she kind of looked and she went, Paul, that's kind of 9-10%. She says, you realise like the population, like relatively the population of Scotland and the UK, Scotland only makes up 8% of the UK.
Right.
Yet you've got more guys, like, you know what I mean? So there's there's 9-10%, there's an extra 2% within that. So I know it's like it's a funny number for folk to wrap their head around, but when you think of that, it's like, how's that as well, you know? So it's not as like unprevalent as people think, especially in Scotland. And it's still cancer, you know. It's like you're not lucky to get any cancer. I always hated that. It's like, you got the best one. It's like, did I?
And then, like, there's things like it was a pure seminoma, is that right?
Seminoma,
yeah. So it was like growing inside my testicle. So that's probably why there was no lumps or anything like that.
Well, I had the same thing.
Right, okay.
Yeah, so mine was inside, but the reason I found a lump is because my testicle had herniated.
Right, okay.
That's the only reason I found a lump.
Oh, right, wow.
Aye.
Yeah, and then I don't know how either, but pathology were able to tell me, like, it hadn't spread, with the CT scan, but it was starting to.
Yeah.
Like, I don't know how they would know, must have been in tubes or, something like that, but they were able to determine that. Yeah.
Which is crazy as well that they're able to do that.
I know.
Like, they're going, it's not quite, but it's about to. It's like,
exactly.
what you seen it packing its suitcases.
Well, it's like, one of the reasons that I was delighted to be asked to come onto the podcast is, like, I know a lot of people will be, I don't know, embarrassed. I don't know if it's because it's your private parts, and folk don't want to either talk about it or they don't want to admit that you have to lose a testicle, whatever it may be. But almost immediately I thought, the more people I tell about this, I mean, I've got my brother, my young son. It's like, please just check yourselves, like. And don't be embarrassed. And what's the worst that can happen? You go to the doctor and you get checked and everything's fine. That's the worst that just check yourself. And so I wanted to talk about it.
Yeah.
Whereas I know other people are, as I say, embarrassed or kind of shut up about it type of thing. But I was pleased to try and spread the word, if you like. So
Yeah, I think that's the thing. It's like there still is an embarrassment about it.
Yeah, I think so. Yeah,
it's we come across it so often that like I was completely embarrassed, and I remember going into the doctors and I was embarrassed about it. And the doctor was like, yeah, right, David, don't get an erection. And I went, my name's Paul. He went, no, but my name's David. Sorry, that's a poor joke.
No, that's an old one, though, isn't it?
So honestly, I love that joke.
No, you're right.
But there still is that taboo about it, and when we get guys like yourself who are willing to kind of just come on and speak about it and put it out there, I suppose going back to then, obviously your anxieties about stuff that didn't happen.
Yep.
What were the things that, systematically you were worrying about that you were glad didn't happen, or I suppose you were not glad at anything happening, but like were things that were worrying you the most, I suppose?
I would say the chemo.
Right.
I'd say the thought of getting chemotherapy was scarier than the thought of actually having cancer.
Mm.
And that's a treatment. It's like, I knew if you have to have that to make you better, but I almost would have, tried to get away with not getting it, if you know what I mean, just because I was so scared of getting chemo.
Mm-hmm.
I don't know why. I think it is, we spoke about the TV programs, and you just see people that are like look really, really ill after having chemo, and it's obviously big doses and stuff. Excuse me, but I would say that was the bit that terrified me the most, even more than losing a testicle or anything like that. It was getting the chemo, and the thought of the chemo. And it's when you're talking about being ill as well. It's like it was on the run up to Christmas, so everyone had the cold and stuff, and I started. Once I'd got my head around getting the chemo, it was like getting this now. If I don't want the flu, and then they have to delay it, and what if I have a temperature when I'm going in and they don't give me it? Because by the time it got to that stage, I was just desperate to get it over with, if you like.
Yeah.
But yeah, I found that scary. What about yourself?
Yeah, I was the same. I think the thoughts that were in my head again, it's the same thing. You're talking about all these guys who you've seen go through it on telly and hearing about people. And when I remember going in, and it didn't hit me until I was sitting in the chair and I'd got my cannula in. I was on the bed actually, and my wife was with me, Pamela was with me, and I was fine. And then they brought the bag out, the bag of doom, and it's all covered up, and you're right, they're all in the PPE, and you're like, this is going into me, like holy crap, like this is. And then that started running through the drip, and I remember being like, oh, okay. Like I don't know what I expected to hit me, or I thought I was going to feel like sick instantly, and even over the course of the couple of days that I was getting it, I didn't feel that I was knackered and a bit kind of sick feeling, but the reality of the expectation didn't match up, so I was the same. It's it was the minute that I felt the drip going into my arm, I was like, okay, this is it. And then I was fine. But it's the anticipation of it, because you don't know.
I just, as I said earlier, it was all these buzzwords that you hear all the time of a tumour, a cancer, the Beatson, chemotherapy. All these words terrified me, and you kind of, once you hear them and you start going through each one, you're kind of just trying to get over it and ticking them off type of thing. But I would say, it was really the chemo, because, the kind of only people that I knew had died of cancer. They'd had chemo, the chemo didn't work, they were really ill with the chemo and still died type of thing. And, it was just that scared me, really. Kind of the most of it.
Yeah, it's a horrible thought as well. It's like, because it's so unknown to you, it's like there's loads of other things you can kind of go like. and again, touch wood, like I've never broke a major bone, but I know that will be sore, but then I know I'll get the cast on and it'll be fine. You know, it's like things like that, you kind of, but the anticipation of like a chemical like that going into you and what it's going to do. And like you say, all the buzzwords, cancer and Beatson, and it's like swimming.
Yeah. No, that was a great analogy, because I remember thinking that myself, that well between, although everything happened for me quickly, you know, between getting, so the very, very end of October, or diagnosed, very end of October, operation, just before Christmas, chemo, touch wood, I'm done. But I remember saying to my mum, I wish it was like a broken arm, where you go to the doctors one day and you get fixed.
Yeah.
So, you know, for me, only having a couple of months, you know, was bad enough, but having people that go through it a long time. But then even now, I suppose I'm still going through it, because I've got the anxiety about next Friday.
Yeah.
I did trying to exercise best I can. I did a spin class the other day there, and fine, no issues at all, doing it well. Went for a shower and stuff after, dried, putting on my socks, hurt my back, but instantly didn't think it would be muscular from doing the spin class. It's like, oh, something's not right. This is cancer returning, because I've got a sore back, because it's going to move my lymph nodes, and you know, all these type of things. So I've got that for 5 years. You know what it's like, and going to all these. I mean, I'm sure I could reschedule it, but I'm already thinking about what can I go on holiday then? Because you know, that'll be 4 months after my last appointment, and then I don't want to miss an appointment, and I don't want to struggle to get another appointment. You know, all these type of things kind of stay with me for 5 years.
Yeah.
You know, it's,
and unfortunately as well, it's like you're in the throes of that right now, and weirdly, you know, it doesn't get much easier. Like it gets easier in terms of like how you deal with that emotionally, but like every time I went to the Beatson or the Gartnavel to get bloods and x-rays and stuff done, it was just dread. Like, see, for 2 or 3 days before, you could see my mood just suddenly drop. And do you feel like that when you're thinking
and
about
I don't want, and I'm not having, and I understand how busy they are, and how, you know, when you go to the Beatson, you need a blood test and you get the raffle ticket. You're like, you know, got 40 people are in front of me type of thing, waiting to go in for your blood test.
It's like that scene in Beetlejuice, eh?
yeah, exactly. But it was like, so I don't know what I was going to say there.
Sorry.
So you know, so that's what I was going to say. When they realise how busy they are, you know, that. So when the oncologist said to me that they won't, if you. So I don't know if it's just testicular cancer or what, or all cancers, but mine's a Friday morning. It's when I go to see the oncologist and get blood test, have a chat in a way. But then I said, what? How do I know? Or if you don't hear anything by Monday tea time, everything's okay. So that's from Friday morning to, so that whole weekend is, all right,
it's gone.
Have they found anything? And then when it gets to the Monday and it's, well, I have my dinner at 5:30, but what if somebody has their dinner at 7:30? You know, like when is it? When I'm all right? You know, I think if they found something, they would get in touch quickly.
Yeah.
The last time I was there, you know how you get like the paperwork that they take off you when you're getting the blood taken, and I think it said like urgent, or you know, one of these words type, like a priority, something like that.
Yeah.
And I asked the nurse that was taking my blood, why does it say that? And she said, everybody's says that from the Beatson, all those blood tests get handled before. If you got a blood test down at your GP type of thing, they get done first. So I think if something did show up, then, you know, I would hear before, you know, it could be, cause she said it was tested by Friday evening type of thing. They would know. But, you know, I understand they're busy, but I would like a wee even a text message or something to
Aye,
say,
just say, "It's
all
okay.
good, see you in 4 months, you know,
Aye.
type of thing, rather than hanging about all weekend and trying not to think about it, but you can't really think about anything else.
Yeah, oh, I totally agree with you. Yeah, just one wee thing, just to say an email or something.
Yeah.
Just to go, no, you're fine.
Yeah.
It's just to go back to like your point before you went in for your op as well. It's like, I think that's what a lot of people need to hear, because I've said this as well. I was terrified, but I was okay until the pre-op questionnaire.
Yep.
And then I started panicking. And then when I was on the trolley and then in the wee pre-op room, like what, I know obviously you're saying you were scared, and that's like, I was the same, but what were your kind of overall feelings, and what was it you were scared of, and what was it you were anticipating to happen?
I don't know, like not waking up probably would be the main one. That, but are you going to, what if you wake up during it? What, all these type of things, and you realise that these guys know what they're doing. And again, like with the anaesthetist, you'll be all right. I'll try not to. I do a fair few of these type of thing, and you're like, that they they're brilliant and they know what they're doing, but it was like, I don't know why, but the operation did scare me. The going under and the type of thing. But as I say, the nurses knew, and they were brilliant. Like one held my hand and stuff like that, and then the next thing I knew, I could kind of waking up in the mornings. I could David, and there was a nurse at my side with a cup of water. But I don't know whether she does or not. But the nurse that held my hand, she said, "I'll be with you through the whole thing."
Yeah,
and I proper believed her. Okay, she'll look at. I looked at her and thought, she'll look after me. Type of thing.
Aye.
And I don't. Do you know how long the operation would take?
I think I want to say I was in there for 2.5 hours. I think was it about, just in terms of kind of, for what I remember. My wife would probably tell you different, but that's. I've never really asked that question, so I maybe did. But I can't remember, because that's one of the things that happened with with my chemo. See, a lot of my experience, it comes back and fits and starts. I've got a lot of kind of brain gaps. I went to Philadelphia to go and visit family in the June, so I was still bald at that point. After my chemo, I was out of treatment, but I was still and there's loads of parts of that 2-week holiday I can't remember. Right, there's loads, over the years, I'll go, I can't remember that bit, and it's just because of the brain fog that I've had because of my chemo.
Do you just drink it as the chemo, or drink it's blocking it out?
Maybe a bit of both. I think there's probably a bit of both. I think certainly traumatic experiences will do that for sure.
I can't remember much.
I
don't think I did much though. I was between the bed and the couch, and I didn't do much, didn't go out much or anything, but that whole time I can't really remember too much. The only thing I said to you before, one thing I loved was butter. Yeah. And now I can't even look at it. I don't know why that has changed. I don't know if when I was feeling sick I had toast with butter and I didn't feel great when I had it, or whatever happened, but now it's just it doesn't.
I'm done with it.
I don't know why, or the chemo changed my taste buds or whatever happened with it. Yeah.
But even your analogy when you talked about the hangover part of the chemo is I felt the same way as that. So I didn't drink for 2 years. I could not put alcohol near my lips for about 2 years because I do not want to feel a hangover feeling. Yeah. Or if I did, I'd have pretty sure I literally never drank, but if I maybe did, it maybe be one glass of wine or one beer. But I just couldn't do it. Couldn't do it.
How do you feel about the I don't want to say I nearly died or anything like that, but trying to embrace going for, you've been through something terrible, you had cancer, if you, me personally, and some of the kind of famous people that have had cancer, if you ignored it, it would eventually get you, type of thing. Aye. And so how do you then want to try and think positively, and me talking about having a sore back and thinking, is that cancer stuff, but I want to
get out of that.
I just want to be positive. I want to think I'm going to live every single day, but I still worry. You know, I want to stop worrying. If you know what I mean. Yeah.
I think for again, it's going to be different for everyone. There's some guys who, well, I've been on the podcast who they've had their experience and they're done. They're like, I'm happy. I think maybe for me, there's a little bit more of a because I talk to the guys and then I basically talk about testicular cancer for a living now. I think that's where positively it happens. I think doing this podcast has helped a huge amount. Being able to talk to folk and meet people who have had it, it's really helped my kind of.
Well, you're literally the only person that I've ever spoke to that I've known that's had testicular cancer. Yeah.
Which is mad when you think of it as well. It's like there's all these guys out there, but you just never cross paths.
Or it might be that they don't want to talk about it. So there might be loads of people that maybe, or not loads of people, but people I've met that have had it, but they don't want to talk about it. I worry, and I know I'm only 6 months in almost of you know, the whole thing. I worry about it. Is it my whole personality? Like, I'll say to my wife, "Did I talk about that too much?" You know, if I bump in, "Oh, how you been?" and you tell them, and then I think, is that all I talk about? You know, the type of thing. So I
think for the next couple of years, you are going to, but especially if folk haven't seen you, and I feel that I had that feeling. I think I spoke to that when you came up to the office, but it was my mates were like, "No, like it's all right. Talk about it. It's fine. It's I don't always initiate the conversation about it, but I'm now at a stage where I can, if somebody asks me like, "Oh, how are you getting on for that?" Like, even though I'm 10, 11 years on, folk will still ask, and I'll talk about this. So. Like there'll be something comes up, so it's fine.
I worry that they'd be saying behind your back, "Did you not talk about anything else?" do you know that way? It's like I don't want it to become me. If you don't.
My pals think I talk pish anyway, so it's all right. But I don't. It will become part of your personality. But it will be a positive way if you look at it positively. It's like you're able to kind of go, "Well, I've had this experience," and again, like. It's not as if you're going up to folk and you're going, "Hi, I'm David. I've had testicular cancer." You know, it's like if it comes up, it comes up, and you talk about it, and folk and generally folk are interested because they want to know.
That's what I was saying. I want to talk if it jars somebody to go, and you know, there was a guy on the football bus that I go to, and he went and got checked, and everything was fine. But I like to believe, and he's told me, to be fair. See, because you were talking about it and you know what you went through, that jarred me to go and get checked. So you know,
and I think that's the thing. It's like there is a bit of that of I don't want to be talking about that. Then there's the embarrassment factor. There's the taboo about it. But I think that's the whole point of, especially like as Cahonas, that we want to get guys talking about it. So if the guys who have had it can confidently talk about it, and it's fine. I actually know of somebody who was through a testicular cancer survivor who had it and has not told anybody they had it. He basically said he went and got a stomach operation, like a hernia type thing. But and he's only told this one person, but he's like, didn't tell anybody. And it's like, wow, like the fact that they've, you know, kind of kept that. As obviously he's told me, but I'm
but you're a pro.
I'm a pro. I'll no name names. But it's funny that there is still guys who will maybe get, like you say, you maybe met somebody who's had it but they've not told you. And the big thing for a lot of the guys is like losing the testicle. Obviously you and I have spoke about it, we're comfortable enough, but oddly enough in the last like 2 months, 2 guys, one who's been on the podcast has actually just got a implant now.
Right, okay,
And one of the guys who, he's not comfortable to come on, but supports Cahonas and kind of spreads the message, but he felt so bad about himself for not having 2 balls. You know, he was like, I can't cope with this. And he went back and got the thing. But even with the testosterone thing, he felt his testosterone was. He went to Greece to get TRT.
Yeah,
You know, like that's, and I think that's some of the things that we don't often talk about when it comes to testicular cancer is everything that comes next. You know, it's like, it's not to say everybody is the same and it's all going to be bad, but it's like there's times where like your testosterone levels are going to dip and flow, and there'll be times where you'll be feeling really rotten and you go, why do I feel like this?
Yeah.
You know, and there's going to be times where you're feeling lethargic and, you know, like my biggest problem was that I blew up like just because like low testosterone, because you need testosterone to help you lose weight. Yeah. So I couldn't lose weight, and then I got depressed because I couldn't lose weight, and then I started eating like a 5-year-old, like just Haribos and Twixes. You know.
So did you have to go on a testosterone thing?
I know. I was always at the point. So like the magic number is 12. However that scale works, I've not really. I should look into it more and be a little bit more informed. But the magic number's 12 in terms of the level, and mine's always teetered around 9 and 11, and they're always kind of like, no, it's fine. I think it dropped down to 7 at one point. But
what was it? Can you remember what the level it is for them to they put you on the testosterone?
Basically, like
below 12.
I was below 12. Maybe like I reckon like anything under 8.
Yeah.
You were kind of looking at. I know at one point after my treatment, I think my testosterone was like 0.02. You know, I had the testosterone, like basically a kind of baby girl, essentially.
Yeah, I mean, I remember the oncologist saying to me when I was asking, because they said your testosterone level, we'll need to look at the TRT type of thing. And then obviously the next blood test. But I remember her saying to me, like, you know, do you really want this testosterone and stuff like that?
Yeah.
And because like I don't know if is it true that it can cause other problems with prostate and stuff like that. So
I think it's like anything. It's like all these medications are going to have like side effects that. But if you were to look at the things that can happen with just taking paracetamol, you know what I mean? Like when you take it, but I think it's getting the balance. Like if it's not affecting you enough.
That was like if you were to read the forms for your pre-op forms and you were to read the, you know, pre-chemo stuff, it was like if you read the back of a paracetamol thing, you know, you'd get a fright as well, type of thing. Yeah.
But I know, but I think it's.
Yeah, I mean, I remember the oncologist said to me, and obviously they were rushing to do it, type of thing. Like, it'd be much benefit if they were to take your testosterone level before you had the operation, because you don't know which testicle was producing, you know, how much testosterone and stuff.
Yeah.
So, you know, what is low to someone else might be your normal. You know, so they don't.
Yeah.
You know,
well, that was always the argument that I had, was that, you know, it's like your testosterone could be up at like in its 20s, and 12's really low for you. You know, but that's what they say. The epidemiologists are like, no, that's all right, kind of thing. But it's all right in a tick box. And I remember speaking to like Dr. White, who was my oncologist before he retired, but he had kind of helped. I remember phoning him because I was really worried about this. And there was this study basically saying that guys who have had a testicle removed and been through like chemo and stuff like that, their testosterone levels can show as normal, but it's the side effects that they should be looking at. But just whatever reason, they just don't. They're just not looking at my side effects.
I think that is again a wee bit I don't know what's the word, like masculating. Like, I've got low testosterone. You know, as if it's you're less. Type of thing, Did you feel any of that, like having lost a testicle to cancer and only having the one? Did you have or are currently having like thoughts like that, like, I feel less of a man, or? Not particularly, but you know,
Good.
it does. But again, you know, I'm happily married, you know, and I'll never be looking for somebody else. But I don't know. I've thought about what would happen if you went. How do you bring that up if you were, you know, Gemma was the next girlfriend? You know, like, how do you say, I've only got one testicle, like to a new partner? As you know, probably everybody would be fine with it. But you know, I have thought thought about that. I mean, but it reminds me of like, which I don't like, you know, it annoys me, and I've, you know, bit back at a few folk that have said it, like, you know, when you talking about like getting the dog and you getting them castrated or whatever, but it changes their personality. And I'm thinking to myself, like, so am I different? You know, I'm still the same person. I'm not any different. You know, like, and that annoys me. Clearly, it doesn't. You know, it's what you are. It's not, you know, not that type of thing.
It's not connected.
Yeah. So like, I mean, I was like, am I because I've only got one? Am I like half as calm? You know, or like type of thing. You know, when you talk to folk about that type of thing.
And folk have got some weird ideas about, like, especially when it comes to testicular cancer, like what it's going to do and how it's going to affect you. I think the biggest thing that we always come across is that it's like, you know, like folk would look at us now and go, oh, right, well, you've had it and you're fine. You know, but it's like, actually, there's so much more to go on.
Does many people get it in the other testicle as well?
It's a low percentage, but yeah, it does happen. So Todd, who is our kind of supporter at the Good Coffee Cartel, he had it twice. So his story is that, you know, he went, got it, and then it was just at the 5-year mark. It was in his other testicle, and had to lose that as well. So, and
did that come up because he had symptoms, or did it come up during his checks?
No, again, I think it was symptomatic. I think it was basically, and I think it was, they kind of looked at a scan as well, or can't remember. It was like, it was bloods or something, and they basically phoned him and went, we've got a problem. And he's like, and it's like, it's returned, we're going to have to do this type of thing, but it was deemed as a whole new cancer, so it wasn't quite a return of the cancer that he had, but it was treated as a new cancer because it was in the other testicle. So Todd lost both of his. He got an implant for the first time round, but he didn't for the second time round because he was like, who cares now? You know what I mean? Him and his wife were together, and I think the biggest thing for them was obviously the fertility issue because he didn't have anything. But he did do the sperm banking, and that's him got 2 kids now. So so like the girls are, I think, I want to say 3 and 1.5 or 4 and 2 type thing. So it must be. Oh God, it must be. Their oldest must be coming up 4. So it's a good thing that they do the sperm banking. I think that's the thing, but it's all the other stuff. You know, it's body image. It's even if you're getting naked in front of somebody, it's your own self. It's your image of yourself.
I'm not that self-conscious. Well, I'm not a show-off or anything either, but I have thought, you know, after the gym and the shower, like, if somebody sees me, you know, like, you need to look. Do you know what I mean? You need to like proper be looking. But I have thought about that before, like, I'll quickly pull my boxers up, you know, and get, you know, when you're getting changed in the changing rooms type of thing.
It's even the scar though as well. You're really conscious of the scar and things like that. It's so different to what people assume it will be for you. You know? I know that it's like when you came in, you kind of had some notes and stuff like that. Is there anything else that you kind of?
No, just the other thing would be with the 5-year plan of getting checked, the MRI scan after every. I don't even know what that entails, where it is or anything, because I'm not at that stage yet. But I presume that's what everybody gets now.
I think that's definitely changed now, because for me it was like 10 years, and it would be a couple of CT scans, but they've moved away from the CT scan to the MRI. MRI, again, it's not comfortable.
Would that be checking lymph nodes and that type of thing? I just
basically just making sure, like, there's no tumours, there's no things like hidden away and stuff like that. And I think probably because of like secondary cancers and that, they've kind of looked at that and went, actually, maybe the CT scan doesn't quite show enough. In terms of like what they're looking for, because obviously an MRI is such a, it's that multi-layer scan. So it's definitely, I'm glad that they're doing it that way, because it means that folks' secondary cancers wouldn't get missed.
Yeah.
You know, and they don't mean to miss these things, you know, but I think it's just making sure that everybody's staying healthy, and as long as we can get that awareness out there as well.
Yeah, well, yeah, absolutely. I mean, that's why I'm here. If somebody listens and somebody thinks, that boy was he that bad? Almost, do you know what I mean? I'll go and see about, in case they're not seeing about it because they're worried about what might follow. Folk will get through it.
Yeah.
You know what I mean? Yeah.
And if, like, obviously, like, at the start of your journey as such, like, I know you're still in it, really, but before, what would you like to have known or have somebody tell you before, like, your operation, your chemo and all that started? Is there anything that you would have, like, even just how you're going to feel or what's out the other side? Is there anything you would have wanted to know?
I would like to have known a few things, but the like medical things, like if your tumour is this size, this is what you'll get offered. You're going to get this type of chemotherapy. It'll be a one-time thing. You'll be monitored for 5 years at the Beatson. There'll be a combination of blood tests and scans, because like somebody else I know had prostate cancer, and they go to the local surgery, get their bloods taken, check the PSA level. That's it. I thought that's what would happen to me. Yeah. Like if they remove all the cancer with the operation, I'll go down to the local surgery, they'll take my blood tests, and if there's no tumour markers or anything like that, I'll be fine. I didn't know about going to the Beatson, so all these things came to me as a shock. Yeah. The chemo, the Beatson, all that. If I'd known all that, I think I'd have still been bricking it. But I'd like to have had, been more mentally prepared for all that type of thing. And then, in October, or it was 30th of October was my operation, and then by first week, New Year, almost back to normal. And when you're going through it, and it's a couple of months, and it's tough, but if somebody had said to me on the 30th of October, see by the new year, it'll be behind you and we'll be monitoring it, I'd like to, knowing that type of thing, go, right, get through this 2 months and then I'll be fine.
Yeah. And I think that's why it's important, like, that these conversations happen, and it's trying to kind of, that's why we've done the podcast. It's so folk can hear, like, they can go, oh, like, I'm getting the same type of chemo, the same as David, and that's going to be my trajectory. All right, he was like this at the end. There's no guarantee you're going to be like that. However, to hear that is the whole point as well.
Well, I'd say that's my main goal for coming on, what is for people to think, and I'm not playing it down or anything like that, and it wasn't great and anything, but in 2 months, and for me, 2 or 3 months, you'll be fine. You'll be fine. Just that type of thing. They're good. They know what they're doing. They look after you, and you'll it's not going to be nice, but that won't last. You'll get better. Yeah, type of thing.
And for us as well as Cahonas, like, we need to figure out how. It's like you're saying you didn't know anything or could find anything, so it's like we need to figure out how we can get our information out even earlier to people as well. So it's like how we get even just the podcast in front of people, how do we get these things so that people who are diagnosed initially, not even had an operation of that yet, are diagnosed initially, hear about Cahonas, and that's the big thing for us, gone since 2009, and you still get people going, oh, I've never heard of these before, he's a new charity, and you're like, no, we're not actually, so it's an uphill struggle. You feel like Sisyphus at times.
I couldn't believe that it was just you and Richie were in doing and how much you have to do to keep it going and all that type of thing. Yeah.
But David, thanks so much for coming on. Check 1 2, mate. Honestly, it's like stories like yours are so important to the community. So
hopefully I wasn't too boring or anything.
Not at all. Not at all. But thank you very much, mate.
Thank you. Cheers.